Welcome friends to yet another episode of HomeoMitra Vartaalap. Today's episode is going to be about what does it take to become a homeopath. So I was wondering whom to ask and whom to talk about this experience. Well, I became a homeopath many years ago. That time was different. And therefore I thought of, calling Dr. Trupti Deyannavar today, who has recently passed her BHMS and her internship and she's working right now, to come to the stage and share her experience with all of us. So, Dr. Trupti, which college you passed out from and what was your BHMS like?
So I passed out from BD Jati Homeopathic Medical College in Dharwad. I recently passed out this year itself. Like 2 months back, I finished my internship and now I'm here.
Okay, great. So, Dr. Trupti, uh, what was your secret to making the best of academics, theory and viva?
So being consistent and revising, recalling again and again, and previous question papers, you helped me a lot. And homeopathy is more actually based on the philosophical background. So, understanding of the philosophy is more important than just memorizing the concept. And during Viva, staying calm and confident helps.
True, I remember the time when the viva used to go on. If your number comes first, then it is a problem. But if your number comes last, not too much of a problem unless and until the people in front of you have all made some silly mistakes with the viva examiner. So, Dr.
Yeah.
Trupti, any challenges that you faced during your study times, and how did you uh, deal with those challenges? How did you get across?
So it was at this beginning, it was very challenging and difficult for me. Like from adjusting to a new place to the academics, everything was very new and complicated at that time. And and I failed anatomy couple of times, and that was very hard phase for me. And at that time, I actually wanted to quit this field and I wanted to change my path. I struggled a lot during that time. And then I went to my principal sir. I went crying to him and I told him, "Sir, I failed again." Then he was like, "See, because you wanted to quit, this is what happened. So homeopathy is choosing you. So if you like accept it and move on, it will be better. If you choose to keep your step behind, then you will end up nowhere," he told me. And that was the moment when I accepted the fact that like even I have to choose homeopathy back. Then everything changed for me. So after that, everything went on smoother. I was more focused on my studies after that, and everything went on smoothly.
Thanks to your principal, sir, that we have
Yes,
Dr.
sir.
Trupti with us today. And she does some very good work in skincare and she creates educational videos on skincare. Do watch those videos. We'll leave a link to her Instagram handle in the comments. And when you spoke about anatomy, I have myself passed with grace marks and I also failed in second year. Yes. So this has happened with, I would not say all of us, but many of us. So if you are one of them, please mention that in the comments and tell us how this made you stronger and how did it help you in your career later on. So Dr. Trupti, I always wonder, for the current generation who are studying, there is so much of distraction with social media and films and movies. I mean, I can recall back then we never had any mobile.
Yes.
The first mobile I think that I got was when I was in my second BHMS,
Mm.
third BHMS I think, and that was an analog mobile like Nokia used to come,
Yes.
3315 or 3310 something like that. The only distraction we had in that phone was that there was a game called as Snakes. Okay, and
Yes.
we could use that mobile only for maybe calling once or twice because even that calling was, for every minute we had to pay, and even for the SMS we had to pay. It was very later on that those schemes started. But for your generation, you have the best of technology, the best of mobiles. They are good, certainly, but at the same time, they are distracting. How do you deal with those distractions and how do you focus on your work?
Um, so I used to make a studying schedule and I used to try sticking to it as much as possible. and most of the time I used to like keep up with it. But at the times when I couldn't, I used to like motivate myself, like thinking about how less time is left and how vast the syllabus is, and constantly reminding myself of the goal which I have marked up for myself, that would help me move on. And like after studying for 40 minutes, then rewarding myself with 10-15 minutes of mobile like usage, would really help.
Well, that's a solution. And I want people watching this video to tell us how you have faced with your mobile distractions and, so many distractions during your study, and how did you plan your, uh, remaining focus to your goal. Uh, Dr. Trupti, I see your handle and on Instagram, and you talk about skincare. I'm sure there must be some motivation or some foundation for you to get into this particular field of expertise. So, could you please share with us about your experience of seeing dermatological cases in your BHMS and internship?
Yes, sir. So I started developing interest in this field when I started skin myself. That would bring me a lot of joy. Then slowly I started studying the labels, then the active ingredients. I started like that used to bring me joy. And when I was posted in dermat department during my civil internship, that time I realized how fascinating dermat is for me. Then I decided to like follow this path. And during my internship, I mostly came across all kinds of fungal infections, acne, psoriasis, eczema. We got to see almost all the different types of cases there. It was very like we got a good opportunity to explore things beyond our limit.
Well, it looks like you have found your simillimum. Like, a patient finds their simillimum in their constitutional remedy. It seems you have found your simillimum in
Yes, sir. Yes, sir.
the science of dermatology. Great, great. Okay. Any experiences of the kind of cases that you had seen as a student in the dermatological department?
We commonly came across all tinea and scabies the most. And due to climatic changes and all everything, those were the like majority of the cases that we saw.
Anything that you feel would be helpful for students who are who want to do something as a sort of a postgraduate in skin? Because as far as I remember, we don't have skin as a subject. Is it? I mean, do we have skin as a subject in MD?
So recently, Ayush has announced that they are going to implement it, but it might take another year. But they are planning to do it. They have introduced the subject.
Well, that is very good news for the students who are aspiring to become homeopaths who specialize in skin disorders.
Yes, I'm really looking forward to doing that.
So with that, Dr. Trupti, we come to the conclusion of the HomeoMitra Vartaalap session today. Any message that you want to share with younger students who are entering into BHMS and maybe even your colleagues?
Challenges will always come, whether it is in the academics or our clinical practice or anywhere. We just need to be confident and persistent always. We need to we need to be rooted to our ethics and be positive all the time. We need to remember that we are in a holistic journey where science and the healing blends together, and we need to be consistent always.
Well, that was a very mature message that you have sent across, especially when you spoke about ethics. That is something that becomes a foundation for doctors. One last question though, any book that you would recommend that which you had read in your graduation vis-a-vis skincare and homeopathy?
Yes, there's a book called Textbook of Dermatology for Homeopaths by Ramji Gupta. That is the book that I read, and it's very good and very informative. Everything is properly elaborated and very like in a concise way, which is very understandable for everyone. Like all the homeopathic remedies it has for the
Okay.
skin conditions.
Okay, excellent. So there is, both aspects are covered, I believe, the clinical
Yes.
aspect as well as. Okay, great. Now, this is really good. So with this, we conclude our HomeoMitra Vartaalap. Dr. Trupti, thank you for giving your time to us and sharing your journey with us, so that not only people are inspired, but they would even know that uh, a post graduation in skincare and working in skincare is very much possible.
Thank you for having me, sir.
All right. Thank you all. See you later on yet on one of the future episodes of HomeoMitra Vartaalap. And we do wish to get Dr. Trupti back again, perhaps as a specialist homeopath who is going to treat dermatological disorders in the coming few years.